Newer therapies in diabetic foot syndrome. Diabetic foot syndrome is an ulceration of the foot associated with neuropathy and different grades of ischemia and infection. About 15 to 20% of diabetic foot ulceration cases requires amputation. The standard of care in the management of diabetic foot syndrome include glycemic control, appropriate nutrition, extensive wound debridement, infection control, and pressure relief. Hyperbaric oxygen therapy. The procedure involves placing of the patient in a compression chamber at atmospheric pressure between 2 and 2.5 atmospheric absolute and administering 100% oxygen for respiration between 60 and 120 minutes once or twice daily. The increased oxygen concentration leads to increased production of both reactive oxygen species and nitrogen species, which play essential roles in signaling pathways for promoting revascularization, matrix formation, and decreased inflammation. Hyperbaric oxygen therapy also increases fibroblast growth factor production and promotes fibroblast proliferation and migration. Negative pressure wound therapy. The procedure involves latex free and sterile polyurethane or polyvinyl alcohol foam dressing of an appropriate size fitted at wound site and covered with an adhesive drape to maintain an airtight seal. A negative pressure of 80 to 125 mm of mercury is used either continuously or in cycles, and fluid sediments from wound are collected in a container. Pulsed magnetic field therapy. This therapy is delivered by an equipment called pulsatron. It generates a highly homogeneous magnetic field in pulsed form inside a specially fabricated enclosure having an array of circular coils powered by alternating current. Bioengineered skin. It replaces the degraded and destructive milieu of extracellular matrix with a new ground substance matrix of cellular components, starting a new healing process. This includes dermagraft, appligraft, and oasis. Autologous platelet-rich plasma therapy. Platelet-rich plasma is a plasma fraction of autologous blood with concentrated platelets obtained by centrifugation of whole blood. The gel is applied locally at the wound site. PRP is a repository of growth factors, cytokines, addition molecules, clotting agents, and leukocytes.